My name is Caleb Dunn, and today we're going to talk about lymphatics care, specifically lymphedema, and we'll talk about some of the types of lymphedema, some of the stages, and some of the exercises that you can do to help treat lymphedema. So what lymphedema is an accumulation of protein-rich fluid, and it'll start affecting your extremities. More importantly, it's going to affect your hands and your feet, and it'll start working its way up. And there's two types of lymphedema. It's primary and secondary lymphedema. And there's approximately 1 to 2 million people that are affected by primary lymphedema and 2 to 3 million people that are affected by secondary lymphedema. So primary lymphedema is going to occur when the lymph system is going to be damaged by a developmental defect. And this is going to be classified by the age of onset, and there's 3 different types. It's congenital, precox, and tardum. In congenital, you can see the lymphedema at birth. Precox, you can see the lymphedema after birth, but it occurs before the age of 35. And then tardum, the lymphedema will occur after 35 years old. Secondary lymphedema is going to occur as a result of something happening and the lymphedema becoming secondary as a result of something happening to the lymph system becoming damaged. For example, breast cancer happening and lymphedema happening as a result of that. So there's different causes for this, and it can be cancer surgery, tumor, traumas, any infection, and obesity as well. So there's different stages of lymphedema as well. The first stage is the latent stage, and this is characterized by actually no swelling at all. As a matter of fact, it might even look normal despite impaired lymph movement. And although there's no swelling, they may complain of tightness in the skin, and they may also feel like the limb is heavy, like they can barely even move it. And even though they're at stage 0, they don't have any swelling, they should still seek medical help to try to keep this from progressing to a different stage. And if it continues to progress on, it can progress to stage 1 or mild lymphedema. And swelling is characteristic in this stage, typically at the distal end. For example, at the distal end, like it could affect your hand and then slowly start working its way up the arm, or in the legs, it can start at the ankle and then slowly start moving its way up to the knee and then all the way up the leg. So the swelling may go away if you elevate it overnight and just for it to come back during the next day. And also, if you press your hand or your finger down on the edema, it'll leave like this little pit or like this little hole, and that's known as pitting edema as well. That's characteristic of this as well. And you can also use elevation and compression wrap to try to help reduce the symptoms of this. Moving on to stage 2, this is moderate edema, and you won't really have pitting as much anymore. It won't really leave the little imprint where you left your finger at. It's going to take a more spongy-like appearance. And the reason it's pitting less than stage 1 is because of fibrosis and general thickening of the skin. And at this stage, swelling won't really help, or elevation won't really help as much with swelling in this stage. And while the swelling is sometimes irreversible, it can sometimes improve with a compression garment, so it still definitely helps as indicated by a physical therapist. Stage 3, this is severe edema, and in this stage the skin can become very hard and it could even become like scaly, and it can also enlarge significantly versus an unaffected limb. And the lymph fluid may also leak outside because of breaks in the skin. And skin folds in this can become difficult to maintain cleanliness and trying to keep it free from infection. And because of this significant enlargement, the limb might be weighted and the patient might not even be able to walk on the affected limb because it's just so large. And so it's going to have an effect on their daily life. And in this stage, they may also require custom compression wraps to try to help combat this. And it's important for a physical therapist to promote compliance in this patient, to try to help with some of the symptoms to get the best possible outcome for them. So some of the interventions you can do, exercise with compression wraps. That's usually effective for lymphedema treatment, and if you exercise too much though, it can cause inflammation, so it's best to avoid exercising too much. And compression, what this does, it causes inhibition of the capillary leakage, which will reduce the edema. And there are other treatments that can include elevation of the affected limb, and for physical therapists, you can also do massage therapy as well. So some of the exercises we can do, if you come over here for me right quick. Alright, so what we're going to do is I'm just going to show you some different exercises you can do. Alright, so the first one we can do is squeezing the ball just like this. Just want you to hold that for 3 seconds and then relax. Alright, go ahead and do that 5 times for me. And while she's doing this, the patient may not be able to do this 5 to 7 times right away, but this is just giving you a little bit of exercise, trying to gradually progress to other exercises. Alright, so the next exercise I want you to do is just want you to bend your elbow like this. Just like that, just hold it for a few seconds, and I want you to do that 10 times for me. And now we're moving just a little bit further up the limb, and what we're trying to do is we're trying to get some of this lymph fluid to come away from the hand, and we're trying to move it further into the body, try to reduce the swelling. Right, and then finally what we can do is, after we can get a little bit of swelling down, now we can start progressing to the shoulder. So what you do is just keeping your arms straight, come out like this, and then out to your side. Alright, so you can also do this 10 times with a patient, and you can even have them do multiple sets, and exercising combined with their compression wrap will help try to reduce some of that swelling up caused by the lymphedema. So in conclusion of this, lymphedema is affecting millions of people in the United States, and if it's left untreated, it can have a significant effect on people's daily lives. And if you have an exercise program and compression therapy, a physical therapist assistant can help reduce the effects of lymphedema as a result. And that's all I have. Thank you for watching.